populations, and they tend to work very closely with the hospitalists. Usually it's the hospitalists who do the deliveries then for those clinics. Okay. So I hope that this is a productive meeting, and like I said, I'm very happy to speak to anyone. I love my job.
And next is Ken Jacobs from the Portland.
At Prince William Hospital in Manassas, Virginia.
Yeah, I met you before.
At which,
yeah. Wasn't sure if you were the same person.
We'll talk after.
How many deliveries do you do per shift for 24 hours?
It depends, and I don't know what you want to do in terms of.
I think we should hold questions here until we get further along, and the speakers will be available for individual questions afterwards.
How many people in the room would consider themselves an OB hospitalist or a laborist? And how many people in this room are just here out of pure interest and want to learn more about it? Well, welcome. I've had a great time in San Francisco. I learned how to talk about sex with my girls at one conference, and just got back from Chinatown to look for some gifts for my girls. So I'm really looking forward to developing OB hospitals. I'm Ken Jacobs, and I'm going to talk to you a little bit about Portland and also Vancouver, which is Vancouver, Washington, right across the river. Legacy Health System is who I work for. Legacy manages or runs 5 hospitals, 4 of which are in the greater Portland area, and 1 is in Vancouver, Washington. Of those 5 hospitals, I would consider 2 of them to be tertiary care centers. That would be Salmon Creek Hospital, which was opened in August of 2005. And they actually opened the hospital with OB hospitalists from the get-go. So they actually have a very unique perspective in that they've generated some data and are able to compare that with other hospitals that don't have OB hospitalists at all. My hospital is in Portland. It's also a tertiary care center, and that's Emmanuel Hospital, where our OB hospitals program was started in September of '06. And Rob Warnock, who's in the audience as well, and myself were the first 2 there, and we were joined by the full group within the following 6 to 8 months. We have a hybrid model. So part of what we do is that we extend the legacy maternal fetal medicine service. Our other objectives include to support the community providers. We provide inpatient care to indigent patients or unreferred patients. We cover the emergency room and also provide GYN consultation to inpatients. And we educate residents and medical students at the Portland Emmanuel site. In extending the maternal fetal medicine service, it allows those perinatologists to actually practice at 3 separate sites. So they are at Legacy Salmon Creek, they're at Emmanuel, and they're at a 3rd hospital that actually is not run by Legacy, but they have consultative services there. And it allows them to be spread out that thinly because we're in the hospital delivering at the 2 sites. It also allows for us to accept transports from all over, from as far north as British Columbia and all over eastern Oregon, Idaho, and Washington, and it keeps both NICUs full of patients. So if you combine the number of NICU beds between the 2 hospitals, there's probably close to 100 or 110 NICU beds, and they're frequently full. We support, like I said, the community providers, and that involves assisting on cesarean sections, standing by when those providers are off-site, facilitating a vaginal birth after C-section so that they can essentially be at home or be in the office or be at another hospital while their patient is laboring, knowing that we are on-site in case a change of delivery mode is required. We also provide backup to several groups of family practice physicians and our own legacy employed certified nurse midwives. And we have created an outreach to several lay midwife home delivery providers in the Portland area. And I'm not going to go into much detail, but we've sort of taken a much different philosophy than several of the other hospitals in the area in order to facilitate those transports sooner when they are safer. We provide, obviously, care to the unreferred patient, the one who walks in with no care, or the traveler who happens to be at a convention in town, and then we arrange follow-up. However, we do not do outpatient care at all. So the OB hospitalists are all hospital-based, and when those patients require outpatient follow-up, like prenatal care, they're often referred to our midwives or to some of the, or to our maternal-fetal medicine service. We cover the emergency room and provide the inpatient consultations, and this involves providing the admission and emergent operative services, for example, ectopics and spontaneous abortions. When a patient is non-emergent but needs to be admitted, then usually the care is transferred over to a shadow call list of community OBGYNs who take over the care of the inpatient care the next morning. We partner with the trauma service. Legacy Emmanuel Hospital is a level 1 trauma center, or level 3, I'm not sure which one, but it's a good one. And often those patients that are pregnant, who are involved in motor vehicle accidents or severe trauma, come back to labor and delivery once they've been cleared by trauma. And of course, we provide consultation to psych services, to the Children's Hospital, which is part of Emmanuel Hospital, and to any other patients that are admitted under other services. We have residents. These are OB residents from OHSU that come to Oregon Health Sciences University, that come to Emmanuel for a second-year OB rotation and a third-year GYN rotation. And we also have family practice residents that come from OHSU, as well as from a Providence, Milwaukee residency program. And then, of course, there are medical students that are on service as well. This is my last slide. It's just the mechanics. We have basically 9 providers, 9 OBs, 4.5 at each site. There's 4 core hospitalists at each site, and then 1 floater that essentially does half-time at either site. We're required to do 91 shifts per year. A shift is 24 hours. We work 81 of those 91 shifts. 8 shifts are credited to us as paid vacation time, and then 2 are unpaid but are excused for CME. And the philosophy at Legacy is median salary for median work. Unfortunately, there is no such thing as median salary for OB hospitalists, and that's something we probably as a group should try to figure out. So they do salary studies based on OBGYNs across the country, and we are paid essentially at the median level. Thank you very much.
And Wayne Farley.
You're going to tell me in 3 minutes as I do, because I
Okay.
can't stop at 3 minutes. I'm bad. My name is Wayne Farley, and thanks for putting this together. I think it's a great idea. I'm the Regional Medical Director for Quest Care Obstetrics out of Dallas, Texas. Quest Care is a physician-owned and physician-operated company that's been